This program is supported in part by a grant from the Coronavirus Response Fund.
Hi, I'm Dr. Angela Sims. I'm a child psychologist and I direct the Children's Center, the Sarah T. Butler Children's Center for the Pastoral Institute. And I'm going to talk to you today about mental health issues in children and how you can identify those in your child and when and how to seek help. Okay, for this segment, I'm going to talk about OCD. Now, parents sometimes will see these traits with children who have been diagnosed with autism. So this is to kind of differentiate, and again, an evaluation will help you to determine if this is part of their autism or if they actually have an obsessive compulsive disorder, and that's what OCD stands for. Many people come to me and say, oh, my child has OCD, or I have OCD. And a lot of times what they mean is that they're just very neat, they're orderly, they're kind of a perfectionist, but they don't really have OCD, or they're just very anxious. To really have OCD, you really need to have the obsessions in your brain that are just going over and over, and compulsive behaviors. And so some of the obsessions could be concerns about germs, dirt, illnesses, body secretions, environmental contaminants. And this is, again, more than what we're seeing with concerns about being COVID, having COVID around. People may have excessive concerns about getting dirty, like some of these children can't handle getting anything on their hands. We're talking about playing outside, playing in the dirt, and getting sticky stuff on their hands. They get kind of freaked out by that. They may have a lot of concerns about getting ill or having any harm come to themselves or someone else. They also may have concerns about harming someone else, feeling that they might act on unwanted impulses of harming a family member, having violent or horrific images in their brain. Fears of doing something terrible or stealing something or having perverse thoughts, fears of losing things. These are kind of recurrent thinking that these children have, and they're distressed by it. It's not that they want to act on it, it's like they have these recurrent thoughts going on in the brain, they can't get rid of them. They may have magical thinking about lucky and unlucky numbers, colors, or words. How many times they need to count or do something before they can move on. They may have fear of offending religious objects or saying just the right thing or not saying the wrong thing. Intrusive sounds, music, numbers coming into their head. And so one of the things that we see is the behaviors that go with that. And so it's seeing things like excessive or ritualized hand washing. Now, we're all doing a lot of hand washing right now, but this would be a little bit more than normal. Instead of washing your hands after you've been someplace or touched something, they're doing it repetitively, like, they wash their hands and stop and then turn around and wash their hands again, maybe 4 or 5 times in a row. Might be excessive in toileting or showering, cleaning of personal items, checking locks. I've had some children say they'll check their lock on their window or door and then go back and check it 4 times. And they may even have a pattern that they have to do it so many times before they can be relaxed. Counting compulsions, like having to take so many steps and then they have to do something. Checking they didn't make a mistake, erasing and redoing things over and over again. And again, it's important to differentiate that between perfectionism and just anxiety that's going on. They may do excessive measures to protect themselves or prevent harm to themselves or others. They may have ritualized eating behaviors where if any of their food touches, then they can't eat it or can't be on the plate, or they have to eat things in a certain order. Now, again, some of those behaviors can be seen with autism because those children with autism often have significant eating problems. But this is where you need to get somebody involved to evaluate the difference between that and the obsessive compulsive problems versus autism. You need that kind of professional involved to help you determine that. They may have rituals also with blinking, staring, touching things or arranging things in a certain way. And again, that might be part of autism, of needing to line things up. A lot of children with autism do that. And so what you're going to be looking for with your evaluation is, does your child just do that, or are they having all the other or many other symptoms of autism as well? A special type of kind of obsessive compulsive behavior that you can see is what we call trichotillomania, which is basically pulling out your hair. It might be pulling your hair on your head, your eyebrows, your eyelashes, and doing that repetitively. And whenever you see that, that's an important time to get an evaluation. And again, see your physician first to make sure there's not some kind of medical problem that's causing these difficulties, but and then if there is not, then you would be referred for an evaluation. And we have psychologists here at the center that do evaluations. We also have telehealth and in-person counseling, and can refer you for medication evaluations. Thank you.